Hello, everyone. Good evening and welcome to the Research Training Lab lectures for medical graduates, incoming residents, and fellows at Larkin Community Hospital. We will have 12 modules together as part of your training curriculum to help you develop your quality improvement and research ideas and projects step by step over the course of this training. I encourage all of you to stay on top of your training steps and keep yourself committed to assignments and expectations of these modules to facilitate your quality deliverables and products for graduation on time. Intelligent research thinking and participation will make your scholarly activities and practices meaningful and provide the values of advanced medical education during your clinical training at Larkin. So I invite all of you to have most of your attention and commitment to this training lab that facilitates your work and required graduation deliverables for scholarly activities. Let us discuss the first module, which is dedicated to finding issues and topics for research. In this module, we will discuss how to find issues, how to find topics for research, how to find topics for quality improvement. We have developed this course last year. As a result of a teamwork, Dr. Kinal Bhatt, Dr. Isha Mehta, and Dr. Marzida Jaffe worked based on my outlining and ideas and expectations and developed content of these modules that is designed to meet your needs and priorities as clinicians and physicians. So this team have tried a lot, and I appreciate here their contribution to the content development of this training cohort with medical graduates, residents, and faculty at Larkin Community Hospital. We had a part of the content for faculty development as well. So let us discuss in the first module with how to find areas of research interest, prioritization of research areas according to contextual criteria, listing issues and problems under the selected area. So we will have area of research, then issues and problems under the area of research. Prioritization method to reach an issue and problem as your scholarly project topic or title, proposing a topic and research question development. So these are learning objectives of our meeting today. This is 12 steps that we will have in our journey to conceive the research idea into a project and into a manuscript and later into publication. For the first module, we will discuss how to identify a research issue and how to prioritize it. The list of issues, for example, that you develop, we will select one of them for research and another one for quality improvement. How to write the issue statement and research question after having that topic. The third module would be finding reliable publication and scientific resources for your study. A study without evidence, citation, and references would be valueless. So you need to know how to search databases, how to search reliable and well-known databases for clinical literature, and how to find the relevant articles and how to value those articles based on their quality and methodologic robustness. The first module would be on critically appraising quality of gathered evidence, how to appraise the quality of evidence. If you want to answer a question about your patient, about the case that you're working on it, or you want to include a study in your research project, how to find a reliable article, how to appraise the quality of articles. In this module, we will discuss. In the first module, we will discuss selecting the appropriate study design. We have many types of study designs, so you have to select one of those designs and methodologies for your specific research issue and research, question that you have developed before in the second module. Applying ethical considerations of research and well conducting of the research would be the sixth module. And the other one is planning ahead for challenges with research, conception, design, and implementation. All of research project authors and researchers will face with different challenges to develop and implement, even design or materialize the research or publish their articles. So we will discuss all of those challenges here to plan ahead how to overcome and how to prevent issues with those areas. Other module, we will discuss developing your study protocol. Sometimes instead of a study protocol, you want to develop a study proposal, a grant proposal writing, for example. In this module, we will discuss what are sections of a protocol, what are sections of a proposal. The other module would be about applying for IRB. Clinical trials need IRB applications, so we need there to inform and training you about IRB application. The other module would be data collection and interpretation. So you need to know how to collect the data, what type of data, what type of variables and tools are applicable for research purposes, and how to interpret statistically, and how to analyze the data that you have collected. The next step would be writing the manuscript, that is, the result of all of your efforts, how to report and how to write a report. And then the last step would be submission of your manuscript to journals. So all of these steps will be discussed with you. Sessions will be after 6 p.m. All Tuesdays, I think, have been planned here. Some of them are not Tuesdays, so we try to keep many of meetings on Tuesdays, but there are different days that you can take a picture right now to see how it has been planned. Also, you have this picture and this plan attached to your emails, that you received as an invitation for this training cohort. Let's start with what's my research area. Research project development is a journey that starts with recognition of research area. What's research area? For example, you talk to your mentor or faculty that I'm interested in working with medical evidence and clinical evidence about cardiovascular complexities of COVID-19. I want to work on issues with COVID-19. I want to work about acute kidney disease. I want to work about autism. I want to focus on preventive approaches and methods for diabetes, for obesity, for solutions or advanced treatments of metabolic disorder, something like that. So you should select a research area. That's the first step. Find out that how your background, history of work and education, uh, supports and fuels this step. If you've worked on a medical condition before, or you have worked in a clinic and you have some experiences, clinical experiences or scientific experiences with one of the medical conditions or a research area that you are more interested in, so select that area. It would be research area. It can be a disease condition like COVID-19. It can be a public health system concept like patient-centeredness or quality improvement or of ER admissions or safety events of post-operative care at Department of Surgery. Sometimes it can be a service provider context like a community hospital or a teaching hospital or a clinical program which is designated to, for example, rheumatology disease or microsurgery, something like that. So you need to start with the research area. Try to find your specific interest. Try to align research area with your uh, medical background and educational background and previous efforts to have a scholarly writing or publication or collaboration with one of the departments in hospitals that you have rotated there. So this is the first step. Start with the research area, and then after that you have to define under this research area what are crucial issues. If you selected COVID-19, if you selected monkeypox, if you selected cardiovascular disease, if you selected preventive medicine or family medicine preventive approaches for substance abuse, for adolescent healthy life or screenings, something like that. So you should list and you should compile a list of crucial issues that you know about that area of research. So try to activate your mind on writing different topics, different issues. And then you should select a study topic and research questions. So that's the process that you should activate your mindset to start with the research area first, because if you have worked on kidney disease or liver disease or stem cell advanced solutions, or you have worked on, for example, dermatology or rheumatology before, and now you have joined Larkin Hospital to start residency program with one of those clinical programs, you have some, background and you have some history of items in your mind that are more active and more likely to be your research interest and your research area. Under the research area, you may highlight the various issues based on situations you or your team have faced with a gap in evidence or clinical knowledge or service gap, patient and family dissatisfaction, or an issue with process. So you have to find issues under the research area. Those could be gaps, shortcomings, issues, dissatisfactions, complaints, waste of time, waste of flow, waste of energy and resources, anything that you think, waste of motion, or a gap in clinical knowledge. Something is under question in that area. Try to list those things and make notes always. You need to practice and exercise uh, to have this list, and then having the ability to prioritize the best topic, the best selected topic from this list. You may develop many problems with COVID-19 treatment. Of course, that one was for the last year effort. Again, it could be a potential topic. Response development. So treatment is one of the issues, crucial issues. Planning is a crucial issue under COVID-19. Response development under this. Patients' adherence to treatment is a crucial issue. Prescription processes and adverse events, complexities, comorbidities, unwanted events, many other things can fall under the research area that can be COVID-19 treatment. COVID-19 is a research area, and crucial issues under that is treatment, response development, adherence, the prescription process, follow-up process, adverse events, complexities, and then many other things. As we can only invest our time and effort in priorities, so we should prioritize our idea by a method, and we will practice that method. We will have a crucial issue as the problem that will be addressed out of your list of challenges and shortcomings. So this is important to understand that for the first exercise for research, find a research area. If you don't have anything in your mind, you should have a literature search. Go to PubMed, search recent years 2021-2022 articles, and grab some ideas from PubMed. I will show you how you can find ideas from other, resources. Let us discuss those. Where do good research ideas come from? The first source of ideas is community issues and media. If you find an issue, a research topic from community issues, results of your efforts and time will solve an issue and unmet needs of the community later. So it would be a value-adding topic and research. Patients and family challenges, feedbacks, experiences, suggestions, or complaints, or other source of finding research topic. Peer conversation, meeting, corridor talks, journal clubs, seminars, conferences, clinical practice gaps, novel cases, perceived problems, case management issues, literature review, gaps in evidence, opportunities to contribute to clinical literature, daily operational and administrative issues, problems, documentation defects, IT challenges, data challenges, discriminative experiences, policy management, and any type of initiatives that can improve the situation. Those are resources for finding some ideas for a good research. Let us discuss one by one. How to find topics for research from community issues. If you look into media and news and find something that is a problem, ongoing problem, contemporary issue for the community around you, for the nation, for the city that you are living with, for the state that you or your family are living with, those are areas that, have the potential to be the research topic if you find a relevant topic to your field of interest. For example, here you see acceptability and effectiveness of hepatitis C care. for people who inject drugs in New York City. It's relevant to an ongoing important issue in a city. Stopping, starting, and sustaining HIV therapy, a mixed method among African American, Black, and Latino long-term survivors of HIV. You see, that's an ongoing issue and problem with a part of population. So you can connect your research topic with a targeted population, vulnerable population, or a precise population with a specific issue or challenge. Racial and ethnic disparities in COVID-19, related infections, hospitalization, and death. It's important that which population subgroups suffered more from COVID-19 to find disparities and inequities. Breakthrough COVID-19 infections after vaccination in solid organ transplant recipients in Miami, Florida. So you see, these are problems and issues of a part of the community. So you can focus on solving these issues through, for example, 6 months efforts that you put into research project. Even if you spend less and you invest, 2 months or 3 months of your educational program and efforts to your research project and quality improvement, it's better to invest on an issue that solves and provides more information for a part of the population. I'm talking about this because I've seen through my, more than 2 decades of experience that medical graduates and students, postgraduate students, are trying to find the topic from literature, to find a previously report or article that is published from online databases and, replicate and duplicate. And, it's a redundancy in medical literature, providing and producing something that have been tested before, have been published before, is valueless. Provide value for your time and effort by finding a value-adding issue or topic for your research and putting priority on, a shortcoming or challenge that solves an issue within the population. Increasing utilization of palliative care services for patients with a CAN score at the Miami Military Hospital, a quality improvement study. Again, it has some, targeted issue in a specified and defined population and context. Diabetes prevention among diverse Hispanic population, considering nativity and ethnic discrimination, accumulation, and BMI. Again, you see, that's a medical condition, an area of research, but it solves issue within specific population subgroup. Black race, Hispanic ethnicity, and Medicaid insurance are associated with lower rates of some sort of, treatment, rotator cuff repair in New York State. Again, you will have a city, a problem, and a specific population. All of them are relevant to community issues. COVID-19 and multi-system inflammatory syndrome in children, a systematic review and meta-analysis. So again, a specific population, a specific disease, and something that is a hot topic and touchy topic right now among the population. Impact of substance use disorder on COVID-19 outcomes. All of those are coming from a history of medical conditions and recent hot topics and issues among a specific population in the community around us. From media news, we can find those articles, those topics. Here you can find that how from community news and media, and from updated and scientific news databases, e-newspapers, journals, magazines, you can find. This is an address. Please take a note on it. Science Daily News, Health and Medicine. You can search it by your keywords. I've searched by diabetes. I've searched here in this magazine. I've searched diabetes and I found these items. You can see to what extent those are, advanced. For example, high fat diet expands waistline and shrinks brain. It's 2022. No more bridge eating signal pathway in the brain that controls food intake discovered. So brain pathways are very advanced ideas about how to control eating behavior among the population. And later, it will be a type of behavioral therapy for medical conditions that is connected and associated with obesity and eating behaviors and habits. The mere sight of a meal triggers an inflammatory response in the brain. Again, reducing sedentary time mitigates the risk of type 2 diabetes and cardiovascular diseases. You can find many triggers here that can be a starting point of your research, of the thoughts for research. A type of step therapy is an effective strategy for diabetic eye disease. Also, you can find what's a step therapy? How can I find more data in our patients about it? Am I able to start this trial at our hospital? Can I provide some case series or advanced approaches for treating diabetics through this, solution that is fully, new and recently published clinical trials are working on it. So you can find many things here in this database. If you search by different keywords, keywords can be your research area, the field of your interest. Even working on recent, debates on policies, healthcare policies that banning abortion or different type of ideas among population about pro-life or against abortion, pro-abortion. So those are debates and controversies that research can provide some responses and provide and can shed a light for those issues. And just imagine publication on these issues, how are valuable to provide updated information about an ongoing issue or an important issue in media, news, or community problems. The other source of topics and issues are patients and family challenges, feedback experiences, suggestions, and complaints. You can look into reflections by patients. If you see some controversial debates weekly in your clinic, in your department, that patients and families are struggling with something, they are calling and reflecting some issues or problems with the care. So that is a topic for research, because You can work on it and solve an issue through a quality improvement project. Having patient feedback and experiences documented, even not documented, only verbal reflections by patients. Having patient suggestions is a source of research because through, putting your focus and concentration on that suggestion, you can reduce the waste, the time issues, emotional challenges, prescription challenges, diagnostic errors, many things, follow-up errors, communications, many things. And if you have access to list of complaints in your department or your clinic, so complaints are not negative things, are free source of solutions. So we should value list of complaints and what are the topic of complaints that have been done recently or recent years by patients, by colleagues, by collaborators, physicians. So those are, free and honest list of topics for the research. When we find, for example, several adverse events on a medical condition or several complaints about delay or error in diagnosis or gaps in follow-up, gaps in uh, continuity of care, gaps in communication, those are valuable resources for having a research topic. What are the most relevant needs of our patients? What are their communication and care preferences? How do they want to engage with us? What information do we already know about them? And what are their specific social determinants and needs? How is their experience with our services and patient journey with our care, feedbacks and behaviors? This is an example of patient journey. It is called patient journey map. For a cancer patient, an illustration of cancer experience map that before diagnosis, after diagnosis and treatment, active treatment, end of active treatment, and about recurrence and different episodes and attacks of the disease, how patients struggle and adopt himself or herself with our care processes, pain points, research findings during different steps of the disease, strategies to cope with the disease, and behavioral factors are important. For example, the initial pain points of the patients with a cancer experience, with a cancer diagnosis, or shock and crisis, feeling, upset and fears. After that, different type of, emotions will shape and form among patients. In each step, we will have some list of signs and symptoms, manifestations, issues with acceptance of the disease, and behaviors that patients try to cope with the disease through those behaviors, and strategies to control those behaviors and to, adopt with the situation, and behavioral factors that help patients to cope with the situation, to accept the diagnosis. And we can, continue this. This can be a topic of research. Patient experience with cancer, patient experience with COVID-19 treatment, patient experience with managing cardiovascular issues, patient experience with open heart surgery, patient experience with post-operative with operation of thyroid cancer. So you can develop many topics here based on patients and family challenges. The other opportunity that you can find topics for your research is peer conversations, meetings, corridor talks, journal clubs, seminars, or conferences. Try to make notes when you are talking or discussing cases in your educational program, in your didactics. Try to make some notes to highlight and find some topics for research. So those are very valuable discussions that you are talking about the medical condition. You are asking questions from your friends, colleagues, and peers, or your faculty, and you are finding, under question areas that you cannot find clear replies and responses for them. Here you can see that strategies to improve quality of care. Those are types of conversation that we are talking about those when we are discussing with our team, with our colleagues. How can we improve the process of this care? Sometimes you will face challenges and complaints or dissatisfaction, even your personal dissatisfaction with the healthcare outcomes of the patients, with the consequences of your efforts for the patient. And then you're thinking about how can I improve the process for the next patient. Sometimes about teaching errors, sometimes about educational strategies or management strategies or data entry strategies. So all of these conversations that comes around you and people are talking about different areas of problems can be source of research, topic design, and priorities. You can see here patients' complaints, qualitative research study on patient complaints, and corridor conversations, clinical communications in casual spaces. All of those can be source of starting a research idea. The other source of selection of research area and research issue as the topic is clinical practice gap. Find a gap in clinical practice. Find novel and interesting cases. Find perceived problems and issues and case management issues. Those are, different areas that you can focus on them as your research topic. Targeted therapies and emerging novel treatment approaches. Novel treatment approaches is a topic that can help other clinicians and medical trainees to learn more about a specific medical condition. Novel treatment approaches. Invasive aspergillosis in critically ill patients, review of definitions and diagnostic approaches. Or here you can find key questions in the new era, new disease era. You can find these terminologies, review of definitions and diagnostic approaches, key questions in the new disease era, emerging novel treatment approaches for a specific medical condition, a review of current and future therapeutic approaches. Those are areas that you can work on and find more information about an under question medical condition that needs, improvement in medical literature and science and advanced solutions to find new updated solutions for the issues among patients that are affected by that medical condition. Again, this is a new solution for a specific population group for neuromonitoring. So current evidence and knowledge gaps. You see, finding new evidence or reviewing the evidence to close knowledge gaps. A review of current and future therapeutic approaches. Where can we find this type of topics? Limitation and future research section in published articles. So if your research area is chronic kidney disease, okay, and you have found a list of issues under chronic kidney disease, and then you want to add updated topics, cutting edge topics and issues to your list, you can go to the limitation and future research section of the current published articles, of the available published articles, to find what are limitations of the published articles that potentially can be your topic of research. If you find something here that authors have addressed that as their limitations, or authors have suggested that for future research, that's a potential topic for your research. I'm providing some hints for, how to start with research that is value adding to close a gap, a current gap, instead of, duplicating a published article. You can find something here that is important and response to needs of the community or medical colleagues to have more knowledge about an under question situation. The other source of research topics are daily operational and administrative issues, communication problems, documentation defects, discriminative experiences. You see, for example, releasing operating room nursing time to care through reduction of surgical case preparation time, Lean Six Sigma. So that's type of waste in operation room that you're developing a solution to reduce those waste and those errors. Continuous peripheral nerve blocks for outpatient orthopedic surgery, improving patient care and hospital efficiency. Through what? Knowledge translation. Improving patient care in Europe via virtual case discussions. That's an innovative, solution. Now it's not innovative, but it could be innovative, or at least people who have documented this have tried to report an improvement through virtual case discussion instead of bedside discussions or journal club discussions. Lived experiences of people living with HIV. Those are some, problems with community of patients. At the same time, those are, daily operational issues. Improving patient care through a collaborative effort in the lead combined geriatric service, an effective provision of multi-specialty input. So you see that researcher team recognized and realized an issue for a specific medical disease, and then they have provided a solution for that issue. Improving patient care through operative reporting, synoptic operative. Again, that's a solution for a recognized and identified issue within clinical practices. So discriminative experiences, defects, problems, and administrative issues within your daily operations. And the last source of research topic, research topic resources is policy management leadership initiatives that improves the situation. Communities are renewable energy for healthcare services. Multi-method study of role of volunteer support for community hospitals. Connecting our services with communities and approaching different methods to educate, to empower, to inform, to raise awareness among community, to engage patient and community. All of those can be topics. Engaging community hospitals in health research is a win-win-win scenario. It's not win-win scenario, it's three-win scenario. Because you can, inform community about areas that health literacy and medical literacy is important in those areas, and you can improve healthcare outcomes among community members at the same time from clinical team performance. Effects of a dedicated inpatient diabetes management service to control glycemic situations in a community hospital setting. You see, those are, management and leadership initiatives to improve something. Again, improving processes in community hospitals or teaching hospitals. Okay, once you identified the research topic and area for research, you can, find different problems that are relevant to those problems. For example, patient-specific clinical question about that specific medical condition. Institutional concerns relevant to quality measures. Resource justification about number of people and team that are working on that specific area. Or process improvement. So again, let us review that process that after area of research, you should find issues under that area. And then you should develop research questions that solves that issues under the research area and research topic. This way you can develop your research topic. Just review these published articles. Many of them are quality improvement PubMed articles. Quality improvement efforts are publishable in reputable and well-known databases like PubMed as a research scholarly production. So quality improvement is not something just to find a solution and doing something. You can report your quality improvement efforts and publish it somewhere. Clinical quality and patient experience in the adult ambulatory setting, quality of prescription. Many things here, physician wellness and missing quality indicators. So you can work on something that is relevant to you, relevant to residents, fellows, and clinicians in the hospital setting. Improving operating room efficiency. So these are types of, quality improvement projects that you can find if you search PubMed quality improvement by the keywords of quality improvement projects on the PubMed. And keep always yourself updated. So just select recent 5 years or 2020 to 2022. So yeah, that way you won't go to the articles from 1990, decade. Regardless of where your research area and idea originates, the research question developed from the idea should address an unmet need or a gap in current understanding, evidence, or practice. So find an area that you can be helpful for your colleagues, patients, families, or scientific community members. Its answer should also contribute to an improved patient care. Evidence review, practice data, patient data, incident reporting system, hospital reviews, complaints, patient experiences, administrative data, and formal evaluation or accreditation reports can help you find a topic that solves an issue. When you are ready to document areas of priorities for your research, start writing about priorities. Start writing about list of potential research topics and interests. So first of all, identify your field of research. Write 3 ideas from the meeting, discussions, and peer talks. This is your worksheet, and this is an expectation to be done during the next 30 days before you finalize your research topic. And that day, after a month, you will start writing issue statement and introduction to your research topic. So please find ideas from daily practices and patient management. It needs to have a notebook in your pocket, always, to write some, notes and thoughts and point of discussions with your colleagues, with your clinical team members, with your faculty in the journal clubs, in didactics. Write, list of things. Then you have time to make an order for those topics and find out which ones are, the 3 top topics for your research idea. Find 3 ideas from the medical literature. It needs to go to PubMed, to go to Web of Science, Google Scholar, Cochrane, CDC. So you can find many ideas, and from the resources that in this meeting I shared with you, you can find those ideas as well. Then you should prioritize between those topics. Here you will have at least 9 ideas. Okay, you can try to prioritize the best one among those 9 areas. How? Based on these criteria: appropriateness of the topic. Score the first topic, the first potential topic, a score between 1 to 5. About to what degree this topic is about an available intervention, technology, or some non-scientific resources. I'm sorry, I've updated that slide to this one. So ignore the last one and then focus on this. Score the first topic that you listed in your worksheet through this checklist for prioritization. Rank and score from 1 to 5. First topic, find out if this topic focus on a healthcare intervention, target population, or solution that is available or soon to be available in the non-scientific resources. To what degree this topic replies to this question? If it replies, in a minimal, with a minimal information or importance, put 1. If it responds to these areas with the maximum, potential, put 5. Evaluate it as 5. If it is relevant to vulnerable, high need, segregated, underserved population group, put 5. If it is not relevant, put 1. Represents one of the priority health conditions. So it's totally subjective, but you should be able to score it between 1 to 5 based on your personal judgment. Okay, this is appropriateness to respond these 3 questions. The second criteria for scoring is importance. To what degree this topic is important? Does it represent a significant disease burden affecting a large population? Number of affected population. If it affects, a remarkable part of population based on statistics and facts that are available, put 5. If it's not, put 1. Score it as 1. So high public interest and its effects on decision-making outcomes and costs. If the solution or topic or problem affects cost of treatment for a large proportion of the global or US population, evaluate it with 5. If it is about, a rare medical condition, only, a medical condition that affects a very limited number of people, evaluate 1. Supported by 1 or more stakeholder groups and interprofessional activity between, for example, physicians from different clinical programs, nurses, public health people, that is called interprofessional, working with different type of backgrounds and educational human resources. 5. If not, 1. Represents importance of uncertainty among decision makers. If something is obvious for you, why you should put your time and effort on it? If it is uncertain and it's needed for clinical decision making, put 5. Incorporates issues around health, both clinical benefits and potential clinical harms. It includes and covers safety aspects of the care, put 5. So the first criteria was appropriateness. The second criteria was importance, novelty, feasibility, and potential value about health outcomes, significant variations in clinical practice. If variation make problem for treatment of the people with that condition, and everyone needs to identify a unified type of treatment and a guideline for treatment, so put 5. If it reduces unnecessary or excessive costs, 5, evaluate it as 5. So these are, the criteria for prioritization. When you listed topics, potential topics from resources that we discussed about, potential topic A, topic X, Y, everything, then you have a list of those. Total score for research issues, total score. If, for example, this topic A has some scores here, you should count the total of both of these worksheets, and as a result, put the total here as total score for research issue A, total score for research issue B, and then compare these scores. The more, the better. The more, the better. So selected topic would be the topic that covers, you know, many of these areas, many of these criterias with the highest scores, with the highest level of evaluation and your judgment. So you will have a selected topic. Please practice these methods together in your teams, in your didactics. You can, allocate one of your didactics to talk about these potential topics together and share your ideas together. It can be a personal exercise, it can be a team exercise, but we need results of this exercise and research practice at least, by the next month. By the next month, we need results and outcomes of this module. Thank you so much for your attention and time. And I wish that this meeting has been useful for you to start the research journey. Bye, everyone, and have a nice time.